guys, how are you doing? I'm hoping you are doing well. Welcome back to today's episode of learning. Today we are going to discuss about a very common disease called gastritis. Um, Gastritis is very common, very common, and so I want us to learn on what is gastritis and what to do just in case you might find out that you have gastritis. So gastritis is an inflammation to the stomach lining called the mucosa. It is an inflammation to the stomach lining called the mucosa. The stomach has a mucus lining. It has a mucus lining that protects it from the digestive acids. You know, the body produces the acids and also enzymes that are used during digestion, and then acids can be corrosive or so the stomach has a lining, a mucus lining that protects it from these digestive acids. Gastritis is classified to two. We have acute gastritis and we also have chronic gastritis. Acute gastritis is of sudden onset, and chronic gastritis is gastritis that is gradual, or it happens over a long period of time. So what are the symptoms of gastritis? What are the symptoms of gastritis? Number one symptom of gastritis, we have abdominal pains. Number two, we have epigastric pains. Number three, we have bloating. Number four, we have vomiters, that is bloody. Number five, we have blood in stool. And number six, we have a burning feeling in the stomach. A burning feeling in the stomach. Those are the classical symptoms of gastritis. Number one, we have epigastric pains. Number two, we have abdominal pains. We have bloating. We have nausea and also vomiting. Nausea is an urge or a feeling that you want to vomit, and you might also vomit. Those are two different symptoms. We also have a burning sensation or a burning feeling in your stomach. We have blood in stool. We also have vomiting blood. Those are the symptoms of gastritis. So what is the cause of this gastritis? Gastritis is caused by, number one, we have a bacteria called H. pylori, Helicobacter pylori. This is the most common cause of gastritis. And what this bacteria does, it affects the stomach lining. It breaks it down. Making the stomach to get into contact with the stomach acids. Number two, we have alcohol use. Alcohol irritates the stomach lining. It erodes and also it irritates and also it erodes the stomach lining. Number three, we have severe stress, and we also have medications. We have a class of medications called non-steroidal anti-inflammatories. An example, we have Brufen. I know most of you know Brufen, and we also have aspirin. These two medications, when used for a long period of time, aspirin and Brufen, it irritates the stomach lining. It irritates the stomach lining, causing gastritis. Those are the four major causes of gastritis. Number one, we have said a bacteria called Helicobacter pylori that breaks down the stomach lining. Number two, we have alcohol use, which alcohol irritates and erodes the stomach lining. Number three, we have severe stress, and we also have medications. We have said a type of medication called anti-inflammatories, non-steroidal anti-inflammatories. An example, we have Brufen and aspirin. If used for a long period of time, they also irritate the stomach lining. So how can one know that you have gastritis? When you go to the hospital, how can the doctor tell that you have gastritis? Number one, through history taking. If you come with these symptoms that we have said, typical symptoms of gastritis, definitely the doctor will suspect that you have gastritis, and then after suspecting, he will go ahead and do some tests. He will do stool tests. You will be required to take a sample of your stool. It will be tested. This bacteria called Helicobacter, it's usually present in blood or stool. If it's present in your body, it will be seen in stool and also blood. So the doctor will do either a stool test or a blood test to check for Helicobacter pylori bacteria. Number two, he will do an endoscopy. An endoscopy is a test that is used to examine. It's a test carried out to examine your GI, through your GI tract. It visualizes your stomach, so the doctor will be able to see if the stomach lining is inflamed. Those are the tests. We have stool tests, blood tests, history taking, and we also have endoscopy. Those are the four tests that are done to get a diagnosis of gastritis. Once the doctor finds out that you have gastritis, what will he do? Management of gastritis. Number one, we have antacids. We say that once this mucus lining of the stomach is destroyed, then your stomach is exposed to acids, gastric acids. And so what the doctor will do, he will give you antacids to protect your stomach. They reduce the stomach acid. They reduce the stomach acid, or they reduce exposure of your stomach to gastric acids. We have proton pump inhibitors. That is a group of medications that are used to block. Proton pump inhibitors block the cells that produce the acids, so your stomach is not exposed to acid. We have, if H. pylori is present in your stool or blood, you will be given antibiotics that will be used to heal this H. pylori bacteria. Yeah, that is simply what the doctor will do. Antacids, proton pump inhibitors, and also H. pylori medications. That is if you have H. pylori. What are the complications? What are the complications of gastritis? Number one, we have stomach ulcers. So if this stomach mucosa, the lining of the stomach, is destroyed, the stomach is exposed to acids, and thus Exposure to stomach, exposure of the stomach to the acids for a longer period of time will create an ulcer in your stomach ulcers or peptic ulcer disease. That means basically you will have a wound, let me say a wound, an ulcer in your stomach. And also gastritis, if not treated for long, just this exposure to stomach acids for a long period of time, you will be at a risk of getting a stomach cancer. Those are the two complications. We have stomach ulcers or peptic ulcer disease, and we also have stomach cancers. So by that you can see that gastritis might seem simple, but if not well managed, it will lead to stomach cancer. So what are the prevention measures? What can we do to prevent getting gastritis? Number one, this bacteria called Helicobacter, its mode of transmission is through fecal to oral route. So as I told you, the doctor will do a stool test to find out that if you have Helicobacter. So if you have Helicobacter, then it will be present in stool. So those people who are infected with the Helicobacter, it is present in their stool. And so the mode of transmission is fecal to oral. So number one prevention measure we have to do is to practice hygiene. We have to practice hygiene, because if it's present in stool and you come into contact with stool, or stool of an infected person comes into contact with the water, and then you take that water, that means you take in that bacteria, goes to your stomach. So we have to practice hygiene. Number one, make sure you drink boiled water or treated water. Number two, cook your foods well. Make sure you cook your foods well, because if it can be present in water and then you wash your fruits maybe or vegetables with cold water, or let me say you wash your fruits with cold water and then you eat raw. Maybe this water was contaminated, it had H. pylori. That's how you will contact it. Proper sanitation, sewers, and also sewers. Just make sure that you practice proper sanitation. Manage your stress well. Everybody has stress. There's nobody who doesn't have stress, but you have to look for ways on how you can deal with your stress or your stressors. Avoid NSAIDs. Avoid Brufen and aspirin if you can, or if you have to take, don't have to take for a long period of time, because they break the mucous membrane of the stomach if used for a long period. Alcohol consumption. Avoid alcohol. And we also have avoid acidic foods. That is how we can basically prevent getting gastritis. And so guys, gastritis may seem like not serious condition, but if not well managed, it will lead to a stomach ulcer. And if you ask those people who have peptic ulcer disease, it's hectic. It's bad. So that is the brief discussion about gastritis. I hope you have learned something. And also share this video, like, comment, And also don't forget to subscribe to my YouTube channel so that we will be learning. And also you can also suggest the topic that you want us to learn, because I told you this channel is for everybody. Those people who are not medics, so the information is simple, so that anybody or everybody can get to understand. So please guys, subscribe, and thank you for tuning in. See you in the next episode of learning. Thank you.